I've always kind of joked, because my granddad on my dad's side passed away of a heart attack. He had several, so I always joked that's how I would die. So having 2 kids this summer, as we were working, they were helping me. There were probably 3 or 4 times over the summer where I started having some chest pains. Nothing long, just a minute or something. And so I would sit down, rest for a minute or 2, and then they would go away, and I'd go back to doing what I was doing. And so that's kind of how it started. And I thought, after a while, I really probably ought to go get this checked out.
So when Aaron reached out to me, I had been at the Longview Good Shepherd campus for right around 8 to 9 months. I was asked by this organization to participate in Leadership Longview as an experience to get to know others in our community, to help CHRISTUS have a presence in our community. Aaron was an alumni and a volunteer, and I remember Aaron on our first day, he got us out of our comfort zone with many different activities and team building exercises. So Aaron was an immediately easy man to talk to and get along with.
Well, once I finally decided that I needed to do something about it, I figured I would need a referral to a cardiologist, so I called my doctor, and the last time I'd been there was 9 years ago. And so they were already retired. So I had to find a new doctor, so I just reached out to the class, said, hey, does anybody know somebody that knows a cardiologist in town, works for one? And then they were like, Kent, this year's class is over there. I was like, no, I didn't think about that.
I guess it was after the first or second week of class, I got a phone call from Aaron, or maybe even a text message saying, if you have a chance, give me a call. And spoke with him a little bit about some of the symptoms that he was having. Being a nurse and being in the cardiology field, we always try not to alarm anybody. But the symptoms that he was talking to me about kind of raised some red flags and some concerns for me. So I gave him some just basic instructions about paying attention to your chest pain, maybe even documenting it a little bit and keeping track of what was going on. And I don't think it was 24 hours later he called me again with some more issues and some pains after he had been at work on the weekend.
It was all kind of real quick. I went in, saw the general practitioner. The next day I saw the cardiologist. He wanted to do a stress test, so we did a stress test, and then that came back. And then on a Thursday, he thought, well, you probably have one artery that's 80% blocked. He said, if there's more than that, when we get in there and we need to do surgery, we'll talk about it. I said, okay. So they went in and do a stent, and they got in there and they had one at 90 and 2 at 60. And they said, no, let's go ahead and do a surgery.
It's easy to ignore symptoms, especially if we've had them for a long time. Generally, people with cardiac symptoms become accustomed to feeling a certain way. They may get short of breath with an activity, but it's easy to justify, oh, I was working hard, or it was hot outside, or this is just me getting a little bit older and things starting to slow down. So with chronic cardiac conditions, you tend to find a way to talk yourself out of getting seen by a physician, or find a way to talk yourself out of getting looked at.
The nursing staff, the people that took care of us afterwards, was phenomenal. I told Ken, I said, once we get out of here and things kind of settle down, I said, I need to have my wife make some cookies or something for your staff. Every nurse that came in each day was just phenomenal.
I remember speaking to my supervisor, Shelly Johnson, afterwards and saying, well, I guess I know why I signed up for Leadership Longview. It already made a difference. And I think that's important to recognize how quickly we can meet people in our community, and as nurses and healthcare providers, how important it can be to listen to those individuals when they bring concerns. I just encourage anybody to trust their gut. If they're not feeling right, if something doesn't seem right, we're here for you guys. We're here to take care of people, and that's what we want to do. We don't want to be intimidating. We don't want to be discouraging. We just want to encourage people to come see us and let us do what we are trained to do to treat you in the best way that we know how.
I was destined for a heart attack. That was my genetics. It wasn't that I wasn't fit. That's what Dr. Verdot said. You're fit. You just have bad genetics on your heart. But because of Kent's help and through the nurses and the surgeons, now I don't have that. So go get checked.
We ultimately prevented a heart attack that Aaron would have had he ignored his symptoms any longer. We try to spread awareness, and that we try to encourage people to listen to their bodies, and I mean, he's a true testament to the reason that we do this. Awareness, rapid treatment, and great outcomes is what we're here for.